am one of the team members of People for Public Services. Today, I would like to welcome you all on the first session. Fortunately, we have got Professor Graham Batts with us, and we are lucky to have him with us. For today, I am going to be your chair, and the beautiful young lady, Amanda Haney, is going to be our co-chair. I'm really honored and really thankful to Amanda and Simon for giving me this opportunity to be the chair of the first session of 2022. So you all are welcome on the board. Now let us see today's agenda. We all can see that there are 4 bullet points here on the agenda. Number 1, who are People for Public Services? People for Public Services is a co-production group, a group of people who is a bridge between the Birmingham City Council authorities and the citizens. Luckily, Simon has given us the title, The Creative Brains Behind the Veil. So we are the voice of the citizens. And luckily, our voice is being heard. The second point for today is Code of Conduct. Number 1, all the comments or questions must go through the chair. Number 2, act inclusively and do not discriminate on the basis of age, disability, gender, reassignment, race, religion or belief, sex, sexual orientation, marriage and civil partnership, and pregnancy and maternity, etc. Respect each other's views. That's the main thing. We all are adults, so treat each other as equals. Check everyone has understood what is said. Speak clearly and use simple language. Definitely jargon free. The second thing is how today's meeting will work. My co-chair, Amanda Haney, is going to go through this journey with you. The last but not the least, Birmingham City Council Corporate Plans 2022 up to 2026. To support, to serve, to level up. Professor Graham Batts, CBE, Director, Adult Social Care. We all know Professor Graham Batts very well. But today I would like to mention a special quality of the professor. The professor is not a boss. He is an inspiring leader. The thing which touched my heart is the professor never comes with a constitution or a draft or a letter saying that we have to work on this one. He always comes with a question. How could we take the adult social care to the next level? How can we engage more people with us? How can more people benefit from our services? Today, I feel lucky to be a part of the team with the professor, and secondly, I can say I'm lucky that I am hosting the chair when the professor himself is with me as the Superman. Professor Graham Batts is an inspiration for all the directors. He has introduced us to many sectors, and in the near future he will do the same. I'm really thankful to you, Professor. You are an inspiration for me and all of us, and I am your big fan. Now I am going to handle the virtual podium to my beautiful young lady, Amanda Haney, who is going to take us through our embarking journey. Amanda, you are on board.
Thank you, Sadiq. Welcome, everyone. Thanks for joining us. And I'm blown away from your words there, as I'm sure Graham is. I'm sure he was blushing at some point, but he'll come in a little bit later. So I'm just going to tell you, welcome everyone. I'm just going to sort of, for the people who haven't joined us before, just to go through how this meeting will work. We've changed how we do it slightly. It's a little bit more, I hope you agree, but you can always feedback and let us know how the meeting will work, and hopefully you'll feel it's a little bit more interactive. So as Simon mentioned at the very beginning of the meeting, we put everyone on mute. That doesn't mean that you can't come in. As Sadiq has mentioned, if you could go through the chair if you want to come in. However, saying that, we've allowed around 30 minutes at the end of the session for questions to come through. So there will be hopefully a big opportunity for you to ask all the questions from Graham's presentation that you're going to see today. The other thing I should mention, we're using something called the car park. So ask any questions you like. However, if it's not quite relevant to what we're talking about today, we might pop it in the car park and come back to it with you after the session, if that's okay with you. But please don't let that put you off asking any questions that you feel you'd like to. So the next slide that you're seeing is a lovely picture of Lisa, who's one of our planning members. And it's just really explaining, for those of you that haven't joined us before, how to, on the right-hand side of your screen, hopefully you'll be able to see a chat section. You can write your question in there and we will come back to it. Or, as I've mentioned earlier, you can put your hand up and we'll bring you in throughout, or ideally at the end of the session when Graham's going to answer whatever questions that you have. Next slide, please, is just explaining about Mentimeter. Some of you, again, will be familiar with Mentimeter. I'm learning this myself too. So what you see on your screen is something called a QR code, which Adib's just going to pop in the chat. What probably the best thing to do is, if you have a smart device, to just scan the code, and that will avoid any need to put numbers in and remember numbers as we go out through this session. So then the QR code will take you through the slides and talk you through the questions as we're going through. I think there's 5 or 6 questions, 5 I believe. So we'll allow time for you to scan the code, or if you prefer not to do that, you can put the number in as we may have done before, but the scanning of the code is the easiest way to do it. So next slide, please. Without further ado, I'd just like to hand over to Graham, who's going to talk you through the next few slides. Birmingham City Council Corporate Plan for 2022-26. Thanks, Graham, over to you.
Oh, brilliant. Thank you very much, Amanda, and thanks for that introduction. And also, thank you for your very kind and generous words, Sadiq. I was blushing, so, but thank you very much. It's very kind of you. So let's make a start. What this session is about the City Council's corporate plan, and I'll get into more detail about it. But what's good is that it gives us in the city an overview of the big challenges we face as we go forward and a way in which we can begin to address them. And obviously what I'm keen to do is to begin that conversation in that context around adult social care. So Simon, could we have the next slide, please? So this is what I'll be covering. I'll be talking about the opportunities and challenges that face Birmingham over the next 4 to 5 years. Then we'll talk about next steps and obviously opportunity for questions. Next slide, please. So inevitably, where there are opportunities, there are challenges, and where there are challenges, there are opportunities. And there are 5 areas that are key for the city. And it come as no surprise to see that the employment, skills and local economy is one, health and well-being, community resilience, cohesion and living standards, climate change and all the challenges that brings, and opportunities for children and young people. So those are the challenges we face, but they also provide us opportunities. I mean, for example, we've got wonderful people who are our citizens who can drive forward the economy and make it affluent so that we can all benefit from their endeavours. So, as I said, shadows, the opportunities and challenges are, both 2 sides of the same coin, really. So, next slide, please, Simon. So, our response to the.
How do you get the slides?
Sorry?
Okay,
sorry.
so can I just come in? Sorry, we just need to pop everyone back on mute. In answer to the lady that's just asked about the slides, that'll all be sent to you after the session and also posted on our website.
I am not too sure.
Okay.
Thank you, Graham.
Okay, thank you, Amanda. So, moving on then. What we would say is that one of the biggest challenges we face, and this has been one for many, many years, is around inequalities. And that's at the heart of our mission, the centre of everything we do, to make Birmingham a fairer city where all citizens share in the creation and benefits of sustainable economic growth and live longer, healthier and happier lives. And that's very much at the heart of what we're trying to do in the city now. And the corporate priorities that flow from that are to create a city that is prosperous, inclusive, safe, healthy and green. So those are the priorities that we are keen to ensure we deliver on to improve the quality of life for all our citizens so they can achieve, as I've said, a better quality of life, live longer, healthier and happier lives. Next slide, please, Simon. So when we think about what we mean by bold, prosperous Birmingham, we're talking about inclusive economic growth. So that's jobs for everyone in the city, not just some types of jobs for some groups, but inclusive economic growth, meaning everyone has that opportunity to benefit from the economic growth in the city. Unemployment and the impact that it has on people's health and well-being is a big issue for us. We want high levels of employment. We want opportunities for everyone to be employed, to enjoy the benefits of work and everything that comes with it. And obviously within this, there's the opportunity of the Commonwealth Games. And that will be an opportunity, it's an accelerant to help improve employment both now and in the future. So if we go into the next slide, I think I'll be bringing Amanda back in and she will take you through this slide. Thank you, Amanda.
Thank you, Graham. So as mentioned, the QR code, if you have your smartphone, you can scan that. It's actually in the chat. Or if you prefer the other method, you can actually pop into your smartphone or device the number that you see on the screen, 8971 6679. Oh, just let that lady in. But the question that we want to ask you, based on the very beginning of the session, is a bold and prosperous Birmingham, as Graham's already mentioned. So what do you believe adult social care should be doing to contribute to this first corporate priority? So that was a bold, prosperous Birmingham. What do citizens believe adult social care should be doing to contribute to this corporate priority? And we're just going to give some time for you to free type your comments, feedback, questions on that first priority. So just somebody's just put in the chat, technology is a pain. Yes, it can be, but it also can be a benefit, which we've found during COVID, that's enabled us to carry on talking to as many citizens as possible. But yes, I agree with you wholeheartedly. It can be a pain at times. But we can see some things generated. Just leave some more time for that. So, Karinda, you've said, sorry, what was the question? So the question was, a bold, prosperous Birmingham, which is priority number one, as Graham's outlined. And what do you as a citizen of Birmingham believe adult social care should be doing to contribute to enable that priority to happen? That's the question.
Amanda, I'll just suggest if there are some that are struggling to get onto, you can always do exactly what you've done already, Karinda. You can type in the chat and we will still pick it up. What we're trying to just do is just capture everything in writing so we've got it. So I thank you, Amanda.
Would it be helpful if we just run over what was, hi guys, so would it be helpful if we just run over what was included on the slide from Graham about being a prosperous, a bold, prosperous Birmingham? So it's about in supporting inclusive economic growth. So it's occupations, careers, jobs, work, employment, all those sort of things. Tackling unemployment and maximising the opportunity of the Commonwealth Games. So it's really just a quick question to you all, just to say, what do you think adult social care should be doing to meet that corporate priority?
Thank you, June.
I tried to put it in the chat, but it wouldn't let me, so I've stopped. I think you've got some good responses there, Amanda.
Yeah, I agree. Trying to move to the next one, Amanda, and then
should we read them? Do you want to just cover those, because you can only see half the slide?
Yeah.
Yeah, okay. Shall I read them through? So make sure all employment is inclusive. Too many people with a disability are kept out of the economy, I think that might say. Recognising the skills of everyone brings, listening to citizens, for disability and health care to support personal care, somebody else has put. Provide opportunities for involvement fairly, absolutely. Inclusive opportunities to all regardless of ability. Another one, develop mental health services, particularly for people with a learning disability. Wholeheartedly agree. And then the last one that I can see, jobs, training, guidance to adult support to care providers. Also, Corinda's just put in the chat, do you think the government should work with social care? And then Mick has said, build and run some specialised respite facilities. So thank you for those. Over to Graham.
Okay, brilliant. So if we move on to the next area, which is about being a bold and inclusive, I mean, the key issues here are really about empowering citizens and enabling citizens to have a voice, and obviously listening to it and acting upon what they say. And that I think it's really important that we continue to build on and develop what we do in adult social care. So we'll obviously be interested in your views on that. And then the other side to that is about promoting diversity, opportunities in different cultures. And you can see all those areas that we've talked about: race, religion, ethnicity, etc., etc. And again, adult social care is doing a lot of work on this in terms of equality, diversity and inclusion. We're keen to do more, and obviously we'd be very interested in hearing your views. So I'll pass over to Amanda and she'll take you back to the Menti slide.
Thank you, Graham. The next question that we have you today, based on what Graham has just spoken about, a bold, prosperous Birmingham. So what do citizens believe adult social care should be doing to contribute to this priority? What do citizens believe that adult social care should be doing to contribute to this corporate priority? A bold, prosperous Birmingham. So that's around diversity, empowering citizens, citizens of Birmingham communities, social inclusion and so on. There's a few coming through. We'll just give some time for that. Okay. So I'm just looking at the one, we've only got 3 at the moment. I'm just looking at the one in the middle, so which says to teach people about safe sex and to support people. There is actually some work going on around this at the moment. So if that the person that wrote that, which we can talk about more, the person that wrote that would like to be involved in some of that work, then please do let us know at the end, and we can get you involved in some of that sexual health co-production work that's going on at the moment. So just to have a quick look at the others, someone said get citizens involved in every council service. That is our aim too, and we can only do that with your help. So if you have ideas that we can reach out to you better, please do let us know, because that, for my team and for Graham and June as well, that's exactly our priority. We want to listen more and hear what you as a citizen of Birmingham has to say. Invite citizens to meetings on an equal basis. Somebody else has said to be included. Funding co-production. That's an interesting one. We are the co-production team, so you know, from my side of things, I do feel that the council is very much geared towards co-production and listening to the voice of the citizen. Otherwise, we as a team wouldn't be here. Somebody else has said to share details about what support is available for citizens in local neighbourhoods. Again, that's interesting, because we have a reference group, co-production group around neighbourhood network schemes, that we'd love you to be involved in that. So that person can let us know at the end if they want to be involved in any of the neighbourhood network scheme co-production work. Make co-production mandatory. That's an interesting one. Also conversations going on around that too. Support with the disability and help the staff as well. Somebody else has said. And again, you can elaborate when we have our open forum at the end. You can elaborate on some of these if you would like to. Learn from COVID about how services are given and received in different communities. Once again, I know there is work going on around that, so we can talk about that in a bit more detail. Consider rewards for citizens to encourage attendance. Many conversations going on around that. So again, we can elaborate. Internet and laptops for volunteers, so they don't have to spend their own money to help the council. Have I covered them all?
Yeah, just a couple of comments in the chat, Amanda, that was all.
Okay, so Joanne has said, I would be interested to know more about the safer sex services that are currently happening. Joanne, yeah, we can make a note and get back to you about that work. Definitely. I covered everybody. Okay, back over to you, Graham. Thank you for that.
Brilliant, thank you, man. There's some really great answers coming in, isn't there, to what the questions we're asking. So that's really helpful. Keep it up. Next is about the green agenda. Obviously, as you know, through the initiatives the council's taken, it's trying to do its best to reduce carbon in a wide variety of ways, including through its the traffic schemes and so on. But it's also mindful that it can't just switch things overnight, that it takes time, and that you have to be careful you don't exclude people from the green transition. So really it's trying to achieve those goals of reducing pollutants into the atmosphere and in different ways. It's trying to get people as much as possible out of cars if that's possible and safe to do so, but also being mindful about being inclusive and ensuring that communities are given the opportunity to transition towards a greener future. So we'll be interested to see people's comments and answers to those points. Thank you.
Amanda, does it help if I just click back? If you ask the question, but if I just leave that for a split second to help people remember what Graham's just said, and then come back once you start getting, does that make, yeah?
Yeah, that
Just
would
to
be
let
great.
everybody, we learn as we go along, guys. So thank you, Amanda. Go for it.
Thank you, Graham. Thank you, Simon. So same again through Mentimeter, we're just asking you how you think adult social care what they should be doing to contribute to this corporate priority around a bold green Birmingham. So that's sort of creating that transition, reducing carbon reduction, and enabling a green transition. So I think there could be, there could be some really innovative ideas out there, and we would really like to know what you think about this priority. So same again, if you could type in what you think, that would be great. Okay.
Just to say, everybody, don't feel like you have to comment on every priority, because obviously some of them are more relevant for adult social care than some of the other areas. So we do accept that. So, yeah, absolutely. Taking recycling seriously is absolutely a fantastic one to suggest. To be quite frank, I'm not quite sure what adult social care can do to encourage that, but maybe they could pop out with a recycling bin when they go out. Maybe. Social workers aren't busy enough.
Well, but I think that's right, Jim. But I mean, certainly we need to make sure, in our care centres and day centres and
Absolutely.
so on, that we really demonstrate that. And certainly when I've been out in visits, I've seen some really good examples of upcycling, building materials and all sorts of things. So yeah, so I think, it's a good point about taking it seriously across the board. Yeah.
Yep. Just while Graham was just while you were filling that in on upcycling, we had a day centre who entered a competition this year and upcycled all their cardboard rubbish into a Christmas tree. So it does happen.
Okay, so they're starting to come through a little bit more now. I'll just start to read a few of these through. So supporting people with toilet or shower. So you may be talking about adaptations, which again, you can elaborate on that, or you may be talking about, making sure that they're available across the city of Birmingham when people are out and about. Better transport links locally. Support solar use, absolutely. June's covered taking recycling seriously and give some examples. Can council employees, that might mean use smart technology better. Perhaps. Yes, we can. Yes, we're trying, and yes, we're learning, and we're all at different sort of levels, I guess you would say, than each other, but we are constantly learning better ways to use technology. And that's not just how we communicate with you, that might be technology enabled care for people who to keep people remaining independent in their own homes for longer. PR cases studies about green members of the social worker teams. PR case studies about green members of the social worker teams. Okay.
Amanda, you got a couple of comments in the chat.
Okay.
That will be PR is in press, Amanda, promotional case studies.
Okay, thank you, June. Somebody else has mentioned about public transport, making it reliable and robust, raising awareness around climate and pollution, promote volunteering on the subject, better applied research. So in the chat, we've got, I'm not quite sure whether that was relating to this question or the one before, from Corinda, if government or MP can be involved too, NHS. We have some of our NHS partners on this call today, and we are always trying to forge ahead to work better with our NHS colleagues. If you need a hospital appointment, they can help. Mick said needs to include trains and air travel, as they are big contributors to pollution. Stricter rules on the use of electric scooters provided by YOU. Could that mean you? As they are a menace to visually impaired people, yes. Again, many conversations going on with our third sector partners in the visual impairment sector around the scooters. Thank you for that. Over to you, Graham.
Okay, brilliant. And we're moving on now to a bold, healthy Birmingham. And there are some of the key priorities that are around tackling health inequalities. I think this has been a long-standing issue. There's a lot of work being done on this in the Health and Wellbeing Board and amongst our health colleagues, looking at what they can do to address these issues. Certainly, we can also think about how we encourage and enable physical activity in Birmingham. Again, improving the quality of care and the quality of the way it's delivered is important issues. And mental health, as many people know, is that there's lots of inequalities in the way mental health services are delivered. So there's a lot there for people to get their teeth into. Amanda, back to you.
Thank you, Graham. So hopefully getting in the swing of this now a little bit more. So it's how you feel that adult social care can contribute to those health priorities. And as Graham's mentioned, it's the inequalities in health, which we know do exist, and sometimes they're around postcodes, aren't they? Where you live, you may get better, or you may feel you get better services where you live. Encourage and enable physical activity, improving quality of care, and obviously the mental health one as well. So if you can let us know how you think adult social care can contribute to that corporate priority, that'd be great by using the Menti chat. Okay. We've only got one so far. So somebody said to teach people how to eat healthy and better. Couldn't agree more with that person. Where possible, do some NCS, I'm not quite sure what that is, interviews with people who have experienced health inequalities. Yeah, but somebody said there's still a need to develop better services in mental health. Absolutely. And I think as a council, very aware of how the recent COVID situation has affected people's mental health. Offer some basic cooking sessions. Somebody said, I agree they need to eat healthy and choose Choose the diet. Commonwealth Games legacy. Make use of enhanced facilities. There is a legacy citizen co-production group ongoing. So if you'd like to be part of that, we can also point you in the direction of the Commonwealth Legacy co-production group. What do you envision for the future of your industry? That's an interesting question for you, Graham. Encourage employers to have a better understanding around mental health and a real barrier to gain employment. Absolutely, and that may be, you may not know about the Pure project, which is a project in Birmingham to help people with barriers to gain employment or training. So we can put you to, if you know someone or if you yourself would like to be put in contact with Pure, we can do that. Easy access to sports or activities. What the greatest failure you've had in your career and how did you grow from it? That's a question for you, Graham, I think. To offer training to people with learning disabilities to support them to look after their own mental health and keep themselves safe. And somebody said schemes available for those who are not able to afford to pay for activities. Absolutely. Just checking to see if there's anything in the chat. So Mick has said we are the most obese country in Europe. So the government needs to introduce a national policy. I agree. Oh, there's a few more. Have an easy public basis. And you said, make our streets cleaner. Absolutely. More community schemes, and we are the most obese country, as we've said, in Europe. So the government needs to introduce a national policy. I think I've covered everyone. Okay. Over to you, Graham.
Thank you, Amanda. So this is the final area. It's about a bold, safe Birmingham, and interestingly, some of the comments made earlier probably fit here as well. Certainly, the first priority is around tackling antisocial behaviour and hate crime. I think that's a particular issue for a lot of the people we serve. They face social injustice on many levels, and hate crime is one of them. So that's certainly something that we think is our top priority. And then the living environment, civic pride and culture, and someone in the previous question mentioned the streets and so on, and I think that's absolutely right. And the police comment on this as well. And I mean, what they say is if the streets are dirty, don't look cared for, it just adds to the general feeling that this isn't a safe environment. So I think these are areas which are priorities for the City Council, and we're really interested in your views about these areas and how they impact on adult social care. Thank you, Amanda.
Same again, how do you think that adult social care can contribute to those priorities, as Graham's just mentioned? So it's tackling antisocial behaviour and crime, an improved living environment that we all have to live in. So it's really how you think adult social care can contribute to those priorities. What are your ideas? I mean, I guess I believe that, I guess I believe that we're all responsible for keeping our streets clean, but I'd be interested to hear what you think. So somebody said they need easy format. Okay. That's Corinda. You might want to elaborate on that towards the in the questions and answers, Corinda. Schemes to engage citizens in their local community, someone said. I'll just point back to the neighbourhood network scheme. There is a neighbourhood network scheme in every constituency, one of the 10 constituencies across the city of Birmingham. So there is a lot being done within the Neighbourhood Network scheme. But we're always open to ideas. School children could be encouraged to help clear leaves and clean graffiti. Somebody else has said. Empower local communities to own their own communities inclusively. I agree. More neighbourhood solidarity and watch. Youth involvement, CCTV and careful monitoring. Leisure areas for youth and those prone to committing crimes, someone else has said. Thank you for that. Any more? Social worker can know about social care because social worker can know about health social care because it's from the local. Okay, not quite sure how that reads. Perhaps it's around the social worker being a little bit more focused in an assessment around health, perhaps. But whoever's that could elaborate a little bit further on if you wish to.
There's nothing in the chat at the minute. Oh, as I say that, Corinda just put into the chat.
Corinda, I think that's you. Thank you. So your social worker can help you with the health parts. Yeah, I mean, maybe that's something Graham can talk around, how much involvement that the social worker has during that 3 conversation with the citizen or the visitant at that time. Over to you, Graham.
Okay, brilliant. Thank you very much, Amanda, and thank you very much, everybody, for your input in that session. So what I hope you'll see when we go through the next session, the next section rather, is what we're planning to do, and hopefully you'll recognise some of the things you've said yourself. And what we'll do is get the feedback from June, Amanda and Simon to then support what the work we're doing in terms of what we're doing in adult social care, what we're planning to do to contribute to the corporate priorities. And first of all, immediately you'll recognise this because it's what you've said yourselves. It's about empowering citizens by listening and responding to those who use services. So very much putting the citizen at the heart of everything we do in terms of making sure we feedback to our colleagues across the council what our citizens are telling us. Again, it's about supporting people to receive the right level of care. That's engaging with the social workers engaging citizens and their families to make sure that we give the right level of care, building on people's strengths, citizens' strengths, rather than falling into dependency. And that's been something that we've been trying to move away from now, this dependency culture for the last 5 years with some success. But it is built upon recognising there is social injustice and that needs to be addressed, which is why in terms of what we're saying to the council as a whole, we're talking about championing equality, diversity and inclusion, community cohesion and so on, but especially for those that experience social injustice. So that's part of what we're feeding in, and I think a lot of the comments that you've made fit so well with what we're saying as well. And then, of course, there's identifying and implementing new initiatives to enhance the equality of opportunity of the workforce. One of the things we saw very clearly during the pandemic was that our workforce very much reflects the citizens in Birmingham. And what's important is that when we take initiatives to support our citizens, we also reflect that to our staff as well, our workforce, and make sure that they benefit from the work we're doing on championing equality, diversity and inclusion. Okay, could I have the next slide, please, Simon? Oh, sorry, it's already someone's covered. That's it. So in terms of what adult social care will do, in terms of supporting young people and vulnerable adults, what I always try and remind people is that children and young people are very important because they become adults. Everybody grows up and becomes an adult. So rather than wait until they are an adult, it's better to actually work with them and begin preparation for that journey much younger. The other thing we've done is extend the neighbourhood network schemes to support younger adults, people aged 18 to 29. and we've introduced the Pure project, which I know many of you will be familiar with. So all initiatives to support young people and vulnerable adults. Next slide, please, Simon. And in terms of supporting, that's it. In terms of supporting communities, again, we really do believe the neighbourhood network schemes have been such a success. We've gained approval to extend them for 5 years. We have an option to extend them 2 years further than that. So that demonstrates a real commitment from the council to supporting neighbourhood networks, which in turn support local community groups, carers, and so on, in local areas. So it's very much at the heart of what we're doing to support communities. We're also recognise that there are communities of identity. In other words, there's spatial communities, communities based on areas, but there's also communities based on people's identity. And there are some small groups who are spread across Birmingham, and we need to recognise they're a community as well. We need to work with them too. And then the Prevention and Communities Grants Programme, one of the big issues for us has always been about investing more money into prevention rather than wait till people get into a crisis. And we've taken that a step further by developing the Prevention and Communities Grants Programme, where we're seeing 46 organisations delivering preventive services and activities benefiting a wide range of citizens in Birmingham. Okay, so if we move on to the next slide, which is about supporting independence. I mean, clearly, one of our key principles is supporting citizens to remain in their own homes, in their communities, if at all possible. So, we never force anyone to do that. But, generally people value their independence and want, for as long as possible and it's safe to do so, to remain in their own homes, in their own communities. So we're developing a programme which will invest into adaptations, use of technology-enabled care, minor repairs, the things that keep people safe and warm in their own homes, community equipment, and also developing pathways into alternative housing when someone's own home no longer becomes, fit and safe for them to remain in. So a comprehensive programme we're developing there to support independence. Moving on, work in partnership. Thank you, Simon. Is the key thing. One of the things I always say to myself, to staff and to partners is, we can't deliver the outcomes we want for people in Birmingham on our own. We have to do in partnership. We have to work with our partners to achieve those goals and achieve the outcomes people deserve. That means beginning with citizens themselves. They're our key partner. That's why we are so committed to co-production. But obviously the rest of the council, commission providers, care providers and so on. The new arrangements is called the ICS, which is the Integrated Care System. That's the new way that we'll work in partnership with the NHS, the acute trusts, the hospitals, the community trust, the community nursing therapists and so on. So we'll be working with that at a more local level, which I think will benefit everyone because it ties services closer to the people that they serve. The Health and Wellbeing Board, who is responsible for developing the health and wellbeing strategy in Birmingham, will continue. It's a statutory body, alongside the Safeguarding Board, which again is also an independent statutory body, and of course our community and third sector organisations who I think we work very well with and will want to continue to do so. So next steps really for the council plan. The intention is that it will be signed off in a cabinet report in the new year. There will then be the elections in May, and after that the plan will then be revised to take account of what's come up during the election, and that will be supported at full council, and that will then become the plan for the next 4 and 5 years. So that's it really. That was all I wanted to say. An opportunity for questions now, or to pick up on comments that came out through people's contributions to that Menti session that we went through with Amanda. Okay, so Simon, June and Amanda, I'll hand back to you to pick up questions and I'll be happy to answer anything I can. Thank you.
Thank you, Graham. Thank you very much. So just thinking about some of the questions that have been asked. One of the questions I think that Mick has asked is to build and run more. I think this was around, and Mick, you can come in.
Yeah,
You've got your hand up. Yeah.
Yeah.
Do come in.
Yeah, I was going to ask another question. That was asked for Gina with regards to respite. I mean, I think Graham's aware of the situation with the respite, suitable respite for certain people with disabilities. There isn't any in Birmingham, which I think is a bad state of affairs, really. To say it's the second city.
Yeah, so I mean, as you know, Mick, we are working really hard on that. Both John Williams and John Freeman are and other members of the commissioning team are actively seeking out respite providers. I think part of the issue and challenge we've all faced is partly as a result of the pandemic, which has had a really adverse impact on a whole range of service provision, including respite. And that certainly hasn't helped our efforts to try and engage with potential providers and to stimulate new providers. That does it, as I say, it doesn't mean to say we've given up on it. We still are trying to pursue it, but it has been, a real challenge in terms of finding providers who want to, engage in that sort of business. So that's the challenge we face, I think, Mick.
Amanda, can I just, sorry, I don't know if you were going to do it. I was just trying to write it in here. Obviously, at the beginning, you said about the hands up function, because there's not many people. Maybe just remind them about the hands up function.
Yeah, okay.
Thank you, Amanda.
Okay. So I don't know whether everyone noticed that Mick put his hand up. He's put his hand up again, so he may want to come back in on that. But we would love you to ask whatever questions you'd like to ask around the presentation, and we'd love to hear your feedback, your thoughts, your comments around the key priorities. Mick, did you want to come back in while we're waiting for other people to come back in as well?
Yes, please. It was another point, not about respite now. With regards to the statement about helping people stay in their own homes. Now, I know Gina and her son live in a property and he's got a spare bedroom. Now, they're getting clobbered by the under occupancy tax, obviously. So a government policy is that if a house has been extensively adapted, it should be considered to be exempt from that under occupancy tax. That would help maybe people who have had a large sum of money spent on the property. And Gina's, for example, is in excess of £150,000 to stop in their own homes without getting clobbered for the under occupancy tax. I mean, I think that's something that maybe could be looked at.
Yeah, I mean, that's a really good point. I'm happy to take that away and come back to you on that, Mick. I can see Gina in the background as well. Hi there. So it's good to see you. Yeah, we can certainly look at that and see how we can support you with that, because it is, well, you can imagine, I mean, after everything I've said about social injustice, I mean, we entirely support what you're doing and want to do everything we can to support you, even if the government isn't being helpful in this one. So let's take that offline. I'll mention it to John and we'll get back to you on that and see what we can do.
Thanks, Graham.
Thanks very much. Thank you.
So, Mick, you also mentioned, I'm sorry to come back to you, but we haven't got any other people want to ask any questions. So you mentioned about sort of around the health inequalities, that, the UK being the most obese country in Europe, and that you would like the government to introduce a national policy. But in terms of adult social care, do you have ideas about how adult social care can prioritise that to help with that problem?
Maybe to lobby the government, and I mean, as you say, I think some others said earlier, to inform people about what healthy eating is, because I think some maybe don't understand the concept to a certain degree, and they think if you take it down to basics of shopping, as one of the other people said, that they don't know about cooking their own vegetables and stuff, which are considerably cheaper than buying like ping meals, microwave meals from Iceland and Co.
Or McDonald's
or
and
McDonald's and Uber, which seems to be the thing with the COVID. Or I'll order that in, and they're spending a lot more money maybe than they've got, where they could get, if they'd had some lessons or whatever, cooking and some information from a government prospectus, they might have been able to cook their own and save a bit of money, you know.
especially with the gas and electric going up.
Yeah.
Thank you, Mick.
Amanda, can I just
Graham.
suggest, I don't want to interrupt Graham. It's just that if there are others who want to ask something, but they can't work out the 3 dots or anything, we totally understand. So if you let it be known, either give us a wave or just say, I'd like to ask a question, and then Amanda can bring you in, just identify who you are. We don't want to exclude you because of technology.
Yep, no, that's absolutely.
Sorry, Graham, go on.
No, it's fine, Simon, and yeah, hopefully that'll help, because it is difficult, you know, on these things. But just to pick up on the point from Mick and Gina, I'll take that away, because I think you're absolutely right. I mean, I think we are incredibly worried about the increase in fuel costs, you know, and what that's doing. And we've seen the headlines in the news and newspapers and so on and so forth, about people having to make, stark choices about keeping warm or feeding themselves, you know, and it's just ridiculous, and particularly for the most disadvantaged people in our society, who this will fall disproportionately upon. So I think, it's helpful for you to raise that here, and as you said, there's a number of things we can do. Certainly, we could do local advice on keeping warm, you know, and how to, you know, and use local schemes. There's things we can do that way, and I think the idea about helping people with food, cooking, all of those things, what's healthy, what isn't, is a great idea as well, and doing some things communally can help with that. I remember when I worked in the East End of London, a local GP told me that, you know, this young Eastern European man had come to see him, and he'd said, you're obese, you're going to get diabetes if you. What do you eat? And the young man, he said, well, I've got a great diet. I eat chicken and chips every night, so I'm really healthy, you know. And it's this kind of misunderstanding about what's healthy and what's not healthy. And what they did, rather than just saying stop eating it, they got a group of young men in similar position, you know, they were migrant workers, and they got them to cook communally, so they learnt from each other about what actually was healthy, and it was also a lot cheaper to feed a group of people than everybody got it eating chicken and chips from the local chicken shop, you know. So I think you're right. I mean, I'll take that back, because there's a lot in that about, you know, the benefits you can get from food and food preparation and doing things together. It's a really good point, so thank you.
I think one of the questions as well around that, Graham, that somebody asked, is around how the social workers, to visit, maybe doing a care assessment, can help with that education side of healthy eating and exercise, physical activity during an assessment, perhaps.
Yeah, I think again, it's that take every opportunity, you know, to ask about a wide range of things, and it's certainly what we encourage our social workers to do in the model of social work we've got, which is 3 conversations. And I mean, that sounds a bit technical. It's not really. It's about being inquisitive. So when you meet a citizen, you don't just say to them, what can't you do? You actually talk to them about their life, about their goals, what they do, what they don't do, and so on, and use that conversation to understand them better. And as you say, Amanda, ask them about their diet, about exercise, because we know these things have an impact not just on physical health, but people's mental health as well. So again, I mean, it's it's an opportunity to make every contact counts. What they say in the health side of things. But I think it's a really good point.
Thank you, Graham. Can I just Simon? Sorry, because Joanna's asked. I don't know whether Graham, you wanted to elaborate about the safer sex services that are currently available. And Joanne, would love you to come in and ask a question, but if you can make yourself known if you want to. Otherwise, we'll just hear from Graham around the sexual health services that are available.
I'm probably the last person you want to ask about that one, Amanda.
Okay. Okay.
I was interested in it myself because I thought that it must be part of the sexual health services the Public Health Commission.
Yeah.
And they commission them from the health services, obviously. So if the citizen on this call drops me a note, or you do it for them, Amanda, I will happily connect them so they can find out more about that service because I'm afraid it's not one I'm entirely familiar with.
Yeah.
Okay, thank you, Graham, for your honesty there. And Joanne, we can definitely connect you to that group who are having ongoing conversations around sexual health.
Yeah. So just because we've got another meeting next week on that, so I'm more than happy for people to contact us, which we'll put our email up at the end, and we'd be more than happy for people to join in them workshops around this. So I was just looking for that really good question that Graham kind of went, oh, that's a big question, and I can't remember what it was around your vision or whatever it was. Can you remember it, Amanda or Graham? Because I think that person who asked it would probably like that answered. Just to put you on the spot, Graham.
There was a lot of really good questions, so I can't remember which one. I'm sorry, Simon.
Yeah, no. And no, it's not there. Did the person who typed it, maybe you were asked, can come in? I'm just trying to encourage people to come in. I know it can be daunting. We completely understand. We've kind of been forced into doing this virtually over a period of time, so we're quite used to it. So for many, it's kind of maybe new. But if not, if there's nothing else, Amanda, then I don't want to keep Graham or anybody else any longer. So I don't know if you want to.
I mean, Mickey, you asked some questions in the chat around, the contributors to pollution. Did you want to elaborate on that with the e-scooters, perhaps? You said that there is an issue with them being misused around a problem with visually impaired people. Did you want to come back about that, Mick?
Yeah, I think I've got it right. I think they're called Voy, are they? The ones that the street introduced. Yeah. They're all. I mean, in Harbour, when I take Luke out, if I come down to take him out, they're all up the paths and everything. I mean, and I did speak to a lady that was talking with Voy, and she got some of these. I don't know if you've seen, they've started putting some parking bays for them now. Because she worked with a visually impaired lady in Birmingham, and she was forever getting run into by these scooters and tripping over them. So they've started to sort of progress onto these parking bays rather than just being strewn all over the path. But where Luke lives, if you go down the road from his house, if I walk him up to Arbon, say, on a day, there'll be 5 or 6 blocking the path all over. I mean, I haven't seen many people using them, really. Not how they're supposed to be used, but and now there's a load of push bikes as well being introduced, isn't there? Like electric push bikes.
Again, I mean, these things are good ideas if they're used properly, but you're right, it's when you find people running up and down pavements with them, and there's older people with prams and toddlers and all sorts. Really, it is dangerous. And I think it's really important that if we're going to support these initiatives, if they're meant to be greener and all that, it goes back to what that slide was saying. There's got to be a balance between doing that and doing it in a way which keeps them safe and all of those things as well. Yeah. So I think you're right.
So we did have Geraldine's hand up. I don't know if Geraldine wants to take herself off mute and come in, or have you changed your mind, Geraldine?
Sorry, it was a mistake.
Oh, okay. Okay.
Sorry, Simon. Can I just I don't know. Oh, Hannah's got a hand up. We've got in the chat. Hannah will bring you in a second. I don't know whether Nancy wants to come in, otherwise I can read this out. Nancy, you mentioned about improving community work, and then further on in the chat you mentioned about supporting single parents. I'm not sure if you're able to want to come in to elaborate on those areas. If not, we can bring Hannah in.
I can see Nancy just put a camera back on, so should we give her a second?
Yeah.
Hello.
Hi, Nancy, we can hear you.
Can you hear me? Can you see me now? Yeah, the reason I mentioned to improve the community service, because it looks like in our community area we hardly have like a community meeting to meet up with the local community people. And I know a lot of people surrounding me, they, especially the elderly people, they really desperately need to see somebody, during the daytime. Because I'm still working, so although I sometimes, pop over to speak to them, but I think, if we improve our local community, service, get people together regularly, people meet up each other and share, a lot of things, and I think it will be, good for the community. And also I mentioned to support, give more support to the single parents, because I'm not a single parent, because at the moment I'm kind of a single parent because my husband is working overseas, and I just realized how difficult being temporarily single parents. You just constantly 24 hours non-stop working. It's really tiring. So just gives because I did give a good thought. I said, oh my God, being a single parent is such hard work. Imagine if the single parents have 2 or 3 children, they really need some support. Because this is my personal experience.
Thanks
Thank you,
for that,
Nancy.
Nancy. Yeah, I mean, I do agree, and I think that's what the neighbourhood network scheme is all about, is trying to enhance and develop local response. So, we will continue to invest in those areas which give opportunity to people to come together. As it is, we'll continue to put on the kind of events that support them. We do that with carers as well. So carers and citizens to try and do it. And obviously, it's continuing to evolve and develop as we move forward. And, our investment is part of that. You're quite right, Nancy. What's important is that people get engaged, and once they do, often they end up volunteering and supporting initiatives, which is really great.
Yeah.
Certainly, there is support for single parents in Birmingham. But the trouble sometimes is that people who could benefit don't know about them.
That's right.
Them in the first place, So I think you're right to raise it, and there's certainly a couple of issues in there worth following up.
Yeah, because I think neighbors, it is very easy, for example, if my neighbor not able to go for shopping, if they tell me I could do when I'm shopping, and I could get something for them. Or, I mean, now people can do online shopping, but sometimes you just want to buy milk or newspaper or bread, it's really hard for them. And that's what I thought, because this were, much easier if labor to help each other, because I do, help my neighbors. Yeah. And I think, because I think everyone seems very lonely because of the pandemic, not able to socialize. So if we have like regularly community, getting together or meetings, and then if people raise some issues, people locally, they can help each other. I mean, this will save a lot of government, funding to have a specific, people working in this kind of area. I mean, labor, just can help each other. That's my thoughts. Yeah.
Yeah, no, I think that's right. And I mean, it's like everything. The pandemic, was dreadful when it
is, yeah.
Dreadful impact on so many people.
Absolutely.
But one of the things that I did see was that people did come together. They did volunteer their help and support, And
That's
what's
good.
important is to continue to build on that and keep
Yeah.
people engaged. So yeah,
Yeah.
I agree entirely. Thank you.
You come, thank you. But by the way, and for our local area, I don't know because I haven't heard any, like community meetings kind of things. But we have got a community center. I do sometimes go to community centers, yeah, which is really good because they offer so many things, yeah.
So again, and we'll take that back, Amanda, Simon, to feed through to Emil in the neighbourhood network service about making sure that the local groups are promoting what they're doing widely. That's the key to it.
Okay, thank you.
Thank you, Nancy. That's really fantastic. And you've also got a comment from Najma in the chat.
Thank you,
It's good
Najma.
to hear you. Good to hear you talking here. She missed the first part of the meeting.
I didn't realize Najma is here. Yeah, thank you. I know her. Thank you very much.
We will definitely take your comments back and link you to NNS as well. Do we have Hannah? Does Hannah still have a hand up?
Yeah, yes, Hannah's still got a hand up.
Hannah, are you there? Would you like to come in?
Yes. Can you hear me?
You can hear you. Go ahead.
All right. Thank you for giving me the opportunity to speak. I think this is the second time I've come for this meeting. And following the first meeting, I've had very useful talks with you and Simon. My question or my comment is, I am still concerned that many of us citizens are not aware of many of these initiatives you're talking about. And I've actually been scratching my head trying to remember how I got onto the first meeting. I'm not sure how I got the email and then signed onto the meeting. So I think the publicity about these meetings and the initiatives that Birmingham City has in stock is not really widely known to people. And so I've just been wondering, which ways can you do, which ways, and I'm happy for the last person's comment about community meetings. That I think is quite helpful if we can have a way that, local, even like there's a neighborhood network, which I think until last week I didn't know about, which I still don't know how to access it, but I've heard about it now. But I think many people are not aware of these projects that are available that people could access. The other question or other comment I have to make was while she was talking, I just remembered something that for me, I could not get involved or get to hear about a lot of things. I had a son with disability, but because I was working, so many of the meetings took place, in his school during working hours. And so I don't attend and I didn't, and it was quite shocking to me that until he turned about 17, did I realize that there was a child that he went to the same primary school with who was accessing some support in the community, which we could have had, but I never knew about it just because I didn't have access to those meetings, and I just think that it's, let us look at people that are also working, that they can somehow be excluded from having access to this information, which would help them support the people around them.
Yeah, really good point, Hannah. And I mean, I think, there isn't an answer. I can't say, oh, we'll do X straight away. We've got to work through the neighbourhood network services themselves and really get better advice and support so they can promote themselves more effectively and find different ways of reaching different groups of people. And as you say, the reaching people that are at work is a very different challenge from reaching people, who aren't in work and so on. So we've got to really pick up these points, feed them through to the neighbourhood network services and indeed to this team to think about how do we promote ourselves and our work more effectively so that we do reach more people. So really helpful to remind us about that, Hannah. Thank you.
Thanks, Hannah, for coming in. Do we have any more hands up?
We've got Sam.
Hi, Sam.
Yes, hello. Yes, so I'm just a bit, it's very interesting to be having forums like this where we can open up and talk about real situations and see how we can get on in Birmingham, as citizens of Birmingham. I just want to look at this issue of marginalization, inclusiveness, equality, and diversity. It is really has been a big issue for me about inclusiveness. We have a lot of marginalized Black communities, and the stories I mean, very devastating when you keep hearing what is happening. It's like the brown and the white against the Black. And I don't know what in Birmingham we are doing to try to stem down these these sort of um, issues. I believe we are all one human being, and like I like saying, one human being created into a one world
Yeah.
by one providence. Color is just a function of geographical pigmentation. Well, I know a lot of white people who have lived in hot sunshine Africa, and their melanin is tanned. And sometimes when I go to Africa, even people who have known me before, so you look fair. Is it because you've been living in England over 20 years? You see, so I'm just saying this to mean that once we have our economic life here and everything, can we just have that equality? It looks like everything is on paper, but the reality is not what we see. In terms of job acquisitions, business, running business, Black businesses, and all that sort of thing. It's really a big problem. And it's not making us feel like we only have to be, you have people who have got PhDs, I mean, highly educated professionals.
Sam, we've got a little bit of breakup on your line.
Yeah.
Would it be all right if I bring Graham back in?
Yeah.
Amanda,
Yeah.
would you mind if I just came back in on that to respond to Sam, if that's okay? And
Go
Graham,
ahead. Yeah,
Graham pick
thanks,
up the
Sam.
wider issue. So, Sam, I am desperate to try and expand the citizens that we work with to represent all areas of Birmingham, all nationalities, all backgrounds, you name it. And if anybody on this call has any networks or any ideas on how I can do that, please let us know, because, you know, we can go to all of the, here we go. Adib's just put a little chat in the box. One of the pieces of work that I'm soon to be picking up is very much around the council's customer service strategy and how we can make improvements to services. I'd love as many as you as possible to be involved in that work, because it's going to touch all council services. But equally, I want those that engagement to be representative of the city. So we've got to do more than just do it online. We know that. But if you can get involved and just give us any ideas, either drop it in the chat or email the email address, or join up where that Gov Delivery address is that Adib's quite kindly put into the chat for me, I'd be really grateful. Sorry, Graham, I'll pass back to you.
Okay, no, thanks, Jim. That's really helpful. And I mean, in terms of the council's approach, it published a report last year, Everybody's Battle, Everybody's Business, and then that has set out a comprehensive approach to addressing issues around marginalisation, equalities, diversity, inclusion, and so on. And I think it's fair to say the council is doing much more in this area than it has done over the past few years. And that includes looking at its workforce, how it recruits people in, how it supports them to develop and get on in their careers. But equally, it also looks at those broader things in education, in business and so on, to make sure that all our citizens have, the equality of opportunity to do their best and achieve their best. And really, that's what it's based on. So I do think after a patchy period, the council is improving what it's doing. It's a much more comprehensive, robust approach. And certainly, we would say in adult social care, the bit of the council services I represent and deliver on, we are managing to improve what we do. We're reducing social inequality. We're improving opportunities for our staff. So it's a really good point, Sam. Fully take it on board. We're not there yet. We're on a long journey, but there is a real commitment to improve on what we've been doing in the past. So thank you for the question.
Graham,
Thanks.
if you're okay, unless there's any other burning things you wish to wrap up, I was going to bring back in Sadiq.
Okay, no, that's fine. Thank you everybody for your contributions, both in the Menti session and in the questions, and hopefully it's been a good session you've all been able to enjoy.
Yeah.
Okay, back to you, Sadiq.
Thanks, Graham.
Thank you, Professor, for your attendance and giving us your precious time. I would like to thank my co-chair, Amanda, June, Simon, and Adib for helping us to go smoothly to this journey of today's session. And above all, I would like to thank all the participants of today who have attended this informative session. Before saying goodbye to each and everyone, I would like to say that our next forum is going to be on Tuesday, 1st March 2022 from 2 p.m. to 3 p.m. Have a good day, stay safe, and take care of yourself. Thank you very much.
And just before people disappear, thank you, Sadiq. We want to thank you very much, but because you are absolutely fantastic as a chair, and it's been a difficult year for you, I know, last year with family and everything else. So thank you once again. And if you're interested, anybody else who wants to get involved in People for Public Services, it's an incredible organisation of brilliant, passionate citizens. Please get in touch. But it's not quite over yet, and I can leave this running. You don't have to do it now, but we'd love to know what you saw. Some of you have put, you know, thank you very much and etc. But we'd like to find out what you thought of today's meeting. Good, bad, what could improve. So we can close. This will still keep open, but let us know what you think about the forum. Nancy, thank you. We'll definitely be in touch to get you involved. So Amanda, do you want to close today? You are the co-chair. I'm just the wizard behind the curtain.
Thank you, Simon. Thanks everybody for coming and giving up your time today. We really do value your input. This forum for People for Public Services forum runs every month, which I think has been put into the chat. So we'd love you to join us again. The subject changes every month. It's always around adult social care. And as Simon's elaborated, we'd love you to come and join some of the co-productions that the groups that we've got going on that we've already mentioned, but also we'd love you to be part of the planning group for this forum and to help Graham decide what's important, what you want the monthly forums to be around. So please do take advantage of that. Thank you very much, everyone. Have a good rest of your day. Bye for now.
Bye, everyone. Thank you. Bye.
Bye-bye.
Bye.